Hi, Helen. How are you?
Hi, Julia. Good, thank you. You okay?
I'm really well, thanks. I am just getting us set up. I'm helping to run the tech today, alongside Vicky. So we alternate turns to lead and support. Love that colour pink on you. It's
Oh, thank you.
popping out so well against the background. Mm. I'll just give it a minute for the others to arrive. I think they're probably all. Here's Vicky. There she is. I'm going to pause.
Now. So welcome everyone to this Q visit about embedding sustainability in QI. Thank you everyone for joining. We know we've got more people joining all the time. This has been a really popular visit. Lots and lots of people signed up, which we're really excited about. It's a really important topic. Thank you so much to Kath Richards and the SusQI team at the Centre for Sustainable Healthcare for hosting us, and to the three SusQI beacon sites who have joined us. So we've got Midlands Partnership University NHS Foundation Trust, South Warwickshire University NHS Foundation Trust, and Cardiff and Vale University Health Board. And we're going to hear from all of them today. You'll meet everyone throughout the afternoon, but Kath, Helen, Joe, Kate, Nick, Faye, and Caroline, if you all want to give a wave so people can kind of spot you for now, you will get to meet all of these lovely people as we go along. We have got the agenda on the screen for you here. You will see that we have a break at 2:15, and we will try to honour that so that you can all have a little rest and refresh in between. We're also going to share the slides afterwards, so just so that you know, you will get everyone's slides afterwards, as well as hopefully some useful links that you can follow up. In a moment, we're going to give you an opportunity in some very small groups, twos and threes, to say hello to each other, because there are lots of people here. We've got 71 and counting at the moment, so we can't say hello to everyone, but we'd love to give you an opportunity to say hello in a kind of bit deeper human way to a few people. So we'll do that in a minute, but before we do, I'd like to invite Katie Young from the Q team at the Health Foundation to share a little bit with you about what is Q and Q membership, because we know that some of you are Q members and some of you aren't. So Katie, can I hand over to you?
Lovely, thanks Vicky. Hi everyone. So yeah, I'm the Q Learning Development Manager. So great to see so many of you here today. And as Vicky said, there are a few non-Q members. So I just wanted to take the opportunity to quickly plug Q membership, and hopefully it'll also be a reminder for members as well on what's on offer. So if you haven't already heard about Q, then we're a community of almost 6,000 people dedicated to driving positive change. Members always tell us that they love connecting with others, and Vicky's already mentioned that you'll be having an opportunity to do that on this Q visit. But people can love connecting with others who also are carrying out improvement work. And we have lots of different free events and visits like this, networking opportunities and learning resources, to name a few. You can join for free and get access to member exclusive funding opportunities as well. So if you would like to know more, please follow the link at the bottom, or Vicky, if you can go to the next slide, there's a QR code. I've got all sorts of webinars, workshops, toolkits, extensive range of online groups as well for you to connect with peers. So to access these fantastic learning opportunities like this visit, please do join us and become a member. We'd love to have you join us. Thank you.
Thank you so much, Katie. So we would like to give you an opportunity to say hello to a few people. Julia, how are we with breakout rooms? Brilliant, thank you. So we will give you about 5 minutes or so in a breakout room, 5 to 7 minutes. So if you find yourself in a room on your own, we will kind of keep an eye out, and might combine some rooms if that happens. So what we'd love you to do is to say what has brought you to the visit today. And also, we have another question for you to think about. What comes to mind when you think about sustainability and quality improvement in healthcare? So I'm just going to put those questions in the chat, unless Julia's got that just for me.
They're in there. Shall I open the rooms,
Oh,
Vicky?
yes, sorry. Oh, yes, it's because they weren't at the bottom of this. Yes, brilliant. If you could open the rooms and you have a bit of time to meet each other and talk about those questions.
There's a couple of people who are just joining, so we can allocate them to rooms in a moment. Ramad and Jamie, we're just opening up some introductory breakout rooms. Should we pop you in there?
Okay. Brilliant. I think we've got everyone back now. I hope you enjoyed getting to know a few of the people in the room in those few minutes. And you should get a chance to say hello to a few more people later on as well. So as we go along, please feel free to ask questions or comments in the chat. This is an interactive session. So without further ado, I would love to hand over to Kath Richards from the SusQI team at the Centre for Sustainable Healthcare to introduce us to quality improvement for sustainable healthcare and to start this visit off proper. Kath, over to you.
Thank you so much, Vicky. Can you hear me okay? I'll just double check. Sometimes my sound can be a bit wobbly on Zoom.
Yes, we
Right,
can.
okay. So thank you so much, and just welcome everyone to this visit. I'm really excited to be here. Really, it's great to see how many people are in the call. So it feels like we've been talking about doing this for a long time and it's finally here. So just to briefly introduce myself, my name's Kath Richards. I work for the Centre for Sustainable Healthcare and lead the Sustainability and Quality Improvement Programme there. So my work really involves, everything to do with figuring out how we do this in the best way. My background, I'm a clinician by background, an occupational therapist, worked in mental health primarily, and then I moved into quality improvement around 5-6 years ago and helped set up the quality improvement team in Birmingham in the organisation I was in at the time. Went through the IHI Improvement Advisor training, and then I moved to CSH around 2.5 years ago. Really personal passion around sustainability and kind of thinking about how I can bring that into my work, which has led me here and all the amazing opportunities I've had. I just wanted to start with a quick poll around where your role, your organisation, and which of these statements relates to you, just to get a sense of where people are at. So I think we're going to launch a poll that will come up on the screen. Great, thank you. So just which of these statements relates most to where you and your organisation are at the moment? So we've got sustainability is prioritised. Do we even need this event? It's talked about, but we're not quite sure what to do. Perhaps you're here as a lone person in your organisation, or even there's resistance to looking at sustainability. We'll give people a moment for that, and then I think we'll be able to see.
Yeah, we've got about 85% of people have filled it in so far, so another couple of moments and then.
Great, thank you, Julia.
Okay, shall I share the results now?
Yeah, go for it.
Great. There we go.
Okay, that's great. So 12%, well, I'm delighted to see that 12% of people feel that it's being prioritised and their actions are being taken, so that's great. And 57% I think is still strong that it's being talked about, given how many people are on the call. help would be great. I'm really hoping that today's session, particularly from the three organisations that are here, will really provide some kind of inspiration about how we can do this in your organisation. But totally understand where people feel that, yeah, perhaps other people aren't on board with it. So I'm just hoping that today will provide a bit of inspiration, guidance, help and support. And there'll be lots of resources that we'll share at the end as well. So thank you for that. Okay, so just a really brief introduction into the Centre for Sustainable Healthcare. I've seen in the chat lots of names and people that I recognise, but I'm sure that there's some people who are coming to this new. So just briefly, the Centre for Sustainable Healthcare, where I work, has been around since around 2008, and really with the key role of engaging health professionals, patients and the wider community to understand the connections between health and the environment and to reduce healthcare's footprint. So that's the primary goal of the work that's always been guided by, and a real leaders really in this area, although I think it's fair to say that there are lots and lots of organisations and work happening now. The main areas that we work on are around clinical specialties, so really trying to influence work in clinical areas, so specialty areas of clinical practice of how healthcare can be delivered differently. Big education programme directed for healthcare professionals. We do work around carbon modelling in clinical care, and we have a great sustainable networks community for those clinical specialties. I'll share some ways that you can link up with people through that community group later. We also have our amazing green space projects and our NHS forest, and that's the real focus of helping healthcare organisations to improve the natural environment and reconnecting people with local green space. And then the SusQI programme, which is really driven by the core principle of CSH of turning knowledge into action. So embedding sustainability into quality improvement, addressing the challenges that we need to address using recognised methods for change in healthcare and the NHS. So that's our kind of core work that we do. So before we talk about improvement specifically, I wanted to set the context of why it's really important for us to be here today more than ever, possibly after yesterday's news. So I just want to do that by way of a quiz. So I'm going to ask a few questions, then we'll just go through a few slides and really in terms of the context of climate and health. So I'm sure some of you are used to this material already, but if you're not, some of it can be, the themes are, can be quite worrying. So I've got some resources at the end for people as well. But this first question is climate change, the climate and ecological crisis is caused by human activity. Is that true or false? So just answer that. When you can, and then if you just let me know, Julia or Vicky, when that's answered.
Yeah, we're at about 82% right now, so I'll give it another moment or two, give people a chance to participate if they haven't already, and it's getting there now, so let's end and share the results. Unanimous.
Brilliant. Okay, so we have people who already know that they're here. So yeah, absolutely, it's true. So we know through rigorous scientific understanding that the climate crisis is caused by human activity, largely the burning of fossil fuels, which release carbon dioxide, which is warming the Earth's atmosphere and destabilising the climate. And this is causing frequent and more severe weather events, such as storms, floods, extreme heat events. And I think the events last week in Spain just served as another stark reminder of how close to home this is. Human activities also, things such as deforestation, habitat loss, pollution are also causing issues around biodiversity loss, which is creating a broader environmental challenge. And these things together are often referred to as the triple planetary crisis. The next question is, the climate and ecological crisis threatens health through any of these, so any all that apply. So increases risk to mental health, increases risk to heat-related death, increases risk to food security.
Okay, we're up towards 80% now. People are getting the hang of it. It's much quicker now, getting the responses through. And I'll give it just another moment before I close the poll. Up at around 92%, 93. Okay, let's see the results for that.
Yeah, great. So I think most people are absolutely right. So yeah, unfortunately, very sadly, it is true. So there are a wide range of significant global effects, which aren't just threats, they are happening now. And those effects are more impactful in the global south, but also happening here in the UK as well. So we know that flooding is increasing, which after a flooding event can have impacts on people's mental health, heat-related deaths. So I don't think we automatically think about that in the UK, but when we had the heat wave in 2022, up to 3,000 people died in that event. And food insecurity is a really big one. Again, it's something that we don't always think about in the UK, but approximately half our food is imported from abroad in regions that are really affected. So yeah, huge risk for us. And the Lancet Countdown is an international collaboration which is published annually. Their 2024 report was released only last week. And it stated they have indicators, 15 indicators, which they monitor climate change related human health hazards, 10 of which had increased and kind of increased to concerning records. So yeah, this is something that is very much increasing. And just a point, I suppose, as we know, the climate crisis is a human justice issue. It's the countries that emit the most global emissions that see less impacts, and countries who emit the least have the most impacts. And of course, those with pre-existing conditions and people who are vulnerable that are impacted the most as well. So very much an inequalities issue. Question 3. So in terms of the carbon footprint of the NHS, the carbon footprint of the NHS is roughly equivalent to the carbon footprint of Kenya. Is that true or false?
Quite a lot of people voting. We're up around 60% now. Just give it another moment or two. Interesting. Bit more variation on this response, getting harder as we go along. Okay.
You're testing people on a Thursday afternoon.
Here we go. Let's see what the results say.
Yeah. So yes, this is true. So the carbon footprint in 2019, when the Green NHS report was brought out, the NHS was approximately 26 million tonnes of CO2. So Kenya's entire carbon footprint is currently around 25 million tonnes. And just to put that into context, the population of Kenya is around 56 million, whereas UK is around 69 million. And that's just our healthcare service. So the environmental impact of the NHS is really significant, and it counts for about 4% of the UK carbon footprint overall. This pie chart shows the breakdown of the carbon footprint. But yes, we know that healthcare is contributing to climate change, which is then impacting on people's health, and is at odds with that pledge of all healthcare professionals why we come to work, which is to improve people's health. Finally, final quick question is, which of the following are true? So this is around global plastic production, car journeys, and pharmaceuticals.
Lots of votes coming in, a bit slower this time. It's a little bit trickier perhaps to work out what you want to share, but we're up around 80% now, so I'll give it just another couple of moments rather. Okay. And let's stop there and share the results.
Yeah, so all are correct. Again, sadly true that all are correct. So healthcare contributes to deforestation and plastic production, which contribute to that biodiversity crisis that we talked about. 1 in 20 UK journeys is thought to be healthcare related on UK roads, which is is a huge amount. And pharmaceuticals have a massive role to play in water pollution. So it's been found that 90% of all administered pharmaceuticals are excreted into wastewater as active substances, which obviously is then toxic to wildlife. So that's the end of the quiz. I'm not going to ask you any more questions. And then I'm going to move on to a slightly more hopeful picture and kind of why we're here. Because there is a lot to remain hopeful for. So whilst the Lancet report that I talked about sets out how urgently we need to act, it always comes with a message that on acting on climate, we will actually become a healthier society with healthier individuals. So a more sustainable society will benefit not only from survival, but as well as our health. A lower carbon sustainable world is a healthier world. And there's some examples of kind of how that looks on the picture here. And so what do we really mean by sustainable healthcare? So we use this definition of using resources to deliver healthcare without compromising the health of current or future generations. And when we talk about sustainability, we talk about it in a holistic way. We're referring to the balance between environmental, economic, and social resources, where sustainability is achieving the optimal outcome of all of those three areas now and into the future, but also ultimately acknowledging that the planet has finite resources and we're dependent on that natural world for our health and well-being because it sits within the biosphere. And CSH developed the principles of sustainable clinical practice to drive and direct the focus of how to develop the most sustainable healthcare systems. And the principles are ordered in terms of their power and importance. The first one being prevention. So if we promote health and prevent disease and tackle the cause of inequalities, we don't need healthcare. We can drive down the need for healthcare. We empower people to manage their own conditions. Again, reducing the impact on healthcare services. Lean service delivery, so streamlining care and minimising wasteful resource use and activities where we can. And then lastly, low carbon alternatives. So where we're delivering streamlined services and we're using resources, can we look at low carbon alternatives? And we've got some examples of those in a moment. But also sustainable healthcare means acknowledging nature's role to keep us well and as a powerful therapeutic tool. I think often we forget that. To me, this seems really intuitive, but there is a huge, large, growing body of scientific research which demonstrates the impact of green space and nature on physical and mental health. And just to reiterate really that sustainable care is high quality care and valuable care. We're here as improvers and quality improvement professionals. It doesn't mean, I think often there's a misconception that sustainable healthcare means a payoff for poorer quality care or perhaps care that doesn't give quite the right service. But actually, when we're focusing on inefficiencies and waste and improvements in care and health outcomes for patients and communities, it's about that co-benefit, as we talked about. It aligns with social value, it aligns with personalised care and reducing social and health inequalities. And viewing improvement through the sustainable value lens has shown to motivate engagement and improvement as well, rather than just focusing on streamlining and costs only. I think as clinicians, we're really, we are here to improve patient care, but also think about the broader community as well. And it's not just a job for a separate department for sustainability lead and of course we need everyone involved in this. So you can see from the NHS breakdown of carbon hotspots, things such as medicines, medical equipment, everyone needs to be involved in the solutions to make healthcare sustainable. And this just means there are so many opportunities for quality improvements within this realm. And sustainability is now widely recognised, I think, the fact that so many people here are the domain of quality. The Royal College of Physicians acknowledged this many years ago, but most Royal Colleges now, professional bodies, acknowledge sustainability as a key domain of healthcare, and that all professionals should understand and incorporate this into clinical practice. And of course, we have one job to do our job and then the other job to improve it. So that means how we improve care as well. We need to think about sustainability. And it's also now considered within regulatory requirements and best practice guidance for organisations. So I said at the top that one of the core principles at CSH is around knowledge into action, which is why the Sustainability and Quality Improvement Framework was developed. And And this really provides an approach not to replace existing methodologies at all, but to integrate sustainability into these key steps. So it's the 4 common steps within any QI framework where we can consider sustainability. And I think as we talk through this afternoon, we'll get more of an idea of that. And when designing improvement, hopefully you can see this okay on your screens, but when designing improvement, the principles that I talked about earlier can be used to generate change ideas and drivers for change that are within kind of the power and the scope of the work that you're doing. And as I said before, they're ordered in terms of their importance from top to bottom. So those ideas around focusing on prevention, patient empowerment, these are things that I think we're already doing in improvement work, but perhaps aren't thinking it through that sustainable value lens when we're thinking about personalised care and collaborative care. And then lean pathways when we're thinking about best use of evidence and streamlining care and pathways. And then lastly, low carbon alternatives. And it's really that kind of energy efficiencies and waste that is at the bottom there, still really, really important, but actually the biggest impact we can have is when we look higher up around prevention and patient empowerment. And finally, really fundamental element to SusQI is encouraging us all to view improvements through this sustainable value lens. So we're really aiming to maximise quality and value for patients. This is all about improving patient care whilst reducing the environmental, social and financial resource use. And importantly, in improvement, trying to measure these things as we make our improvements. And these are just some ways and things that we can do to measure. And we're going to talk a bit more about that as we go on to the organisations, how we do that practically in improvement. This is importantly not about reinventing the wheel. It's not a different methodology. It's about using the QI tools that we all have to make change within the area of sustainability. And I think as an improvement community, we have so much knowledge and so many skills to drive this. Improvement is all about sharing knowledge. It's all about empowering others to take local action. Between us all on this call today, we have so many networks, and I think as an improvement community, we have a real opportunity to influence change across healthcare, and I think potential to have a massive impact. So I think potentially we could improve and scale this up quicker as a community. And I just want to end on I'm really excited to hear from the 3 organisations, 3 SusQI beacon sites today. So we at CSH have worked with Midlands, South Warwickshire and Cardiff and Vale through our SusQI Academy programme over the past sort of 18 months, 2 years, to integrate some of the concepts that I've just talked about into existing improvement teaching programmes, so that they can then support their organisations and local teams with this work. And so, I'm really looking forward to hearing how that work's progressing. But as we go through those sessions, it would be good just to think about these questions. What are the opportunities to use improvement for sustainability in your role? I'm sure everyone's got lots and lots of ideas and are already working on this already. What are the opportunities to align sustainability or consider the sustainability impact of improvement initiatives? Because I think there's so much work already happening that if you just view it through that lens and how we can kind of measure and make that a key driver and measure the impact of it. And then also what further resources and tools and support you need, because that's what we're really here to do, is to kind of think about how we can support that. So that is it from me. Thank you so much, Vicky and Julia. I will I'm going to pass on to Helen, I think. That's right, isn't it? Yeah. Helen was one of our first pioneering Academy members, and they've done such amazing work at Midlands. So I'm going to pass over to you, Helen. I'll stop sharing.
Thank you, Kath. I think I'm sharing successfully. And thank you to everyone for giving us the opportunity to talk to you today about us becoming a beacon site and our journey. So what Jo and I are going to talk to you about today is our journey to become a beacon site, but also what we've done since then. We're going to talk to you about next steps that we've got planned and key takeaways that we've learned. So a few tips for you to take away, and there'll be questions to ask all of us that are presenting today, some questions at the end as well. So just to give you a bit of an oversight about who we are as an organisation, Midlands Partnership University NHS Foundation Trust, or MPFT for short, predominantly provides in Staffordshire and Stoke-on-Trent, Shropshire, Telford and Wrekin, physical and mental health, learning disability and adult social care services. But we also have a lot of specialist services across the wider geographic area, from Yorkshire and Humber all the way down to the Isle of Wight. So things like drug and alcohol services, sexual health services, forensic services. I won't list them all else, I'll take up all the time. But that's just to give you an idea of how large we are as an organisation, over 8,500 staff. So the quality improvement team and the green team both sit under the continuous improvement umbrella in the organisation, which also incorporates clinical and practice networks and the system and partnership continuous improvement as well. But we're just going to focus on QI and green team for the purposes of today. So the QI team is a well-established team. We've been in place since 2013 and we've got a well-established methodology, but we're a very small team of just 4 people. The green team was established in 2022. Again, just a small team of 2 and a bit in response to the net zero commitments basically that we needed to sign up to. That was a key driver for setting up the green team in the first place. So our journey really started when we needed to think about how we're going to respond to this NHS target as an organisation, and how we think about our environmental responsibilities, and setting up the green team was part of that. We also needed to consider how we ensure that we are considering environmental sustainability as part of our quality improvement approach. So what we started to do then was explore this Centre for Sustainable Healthcare's SusQI resources, which are freely available to anybody. And we started to consider how these principles could be incorporated into our current QI programme. We were keen that we didn't want to scrap what we'd already got and start something afresh, but we wanted to embed something into it. The other thing that we really wanted to do was to think about how the QI team could learn from the green team and vice versa. So the QI team spent a lot of time looking at SusQI, and the green team also undertook our leading quality improvement training as well. Also, one of the first things that we did early days is myself and Monica, who is the sustainability manager, we co-delivered training at Keele University to a group of nurses. So this was the first time we'd practiced kind of putting the 2 things together. So I started off by delivering the quality improvement training, and then Monica went on to talk about the green agenda. And that's when we thought, okay, yeah, we did a good job of presenting, but actually they needed to be mushed together better than that. So we needed to think about how we integrated them together. So that was the very start of the journey. And then in September 2022, we formalised that relationship with the Centre for Sustainable Healthcare, and we gained aspiring beacon site status. And that's where Kath really started to help us out in terms of how we were going to, this just felt like a massive thing, and how we were going to sort of break it down into bite-sized chunks. And as Kath has already alluded to, this isn't about starting something from scratch. This is about using existing QI tools and building on that. So Kath was really good, and her colleagues were really good at having coaching type conversations with us, mentoring us and guiding us, asking what we'd done, asking what we were planning to do next, challenging us in a really kind, lovely way. The educator maturity assessments were a great tool because they were a sort of starting point, a benchmark, and helped us to sort of guide our way through. We developed our own action tracker, which helped us again break down this massive thing into bite-sized chunks and to allocate different tasks out to different people, so it didn't feel so big for one person. It was back then in 2022 that we developed our strategic sustainability group, which is chaired by our Director of Quality. So that was great to have that senior buy-in at that point in time. Listening to all staff across the organisation, but particularly the quality improvement team and the green team, to really think about how we move this forward, what are people thinking, was key. And we started to redevelop our materials, so building in the SUS element into our different levels of training, looking at our tools and thinking about how we can embed things into there. And some of them were just really simple things, like on our ideas form, making sure the triple bottom line was mentioned to prompt people. So yeah, lots and lots of discussions, and our sustainability manager undertook a leading quality improvement project, which I'm going to talk to you about briefly on the next slide. But we gained established beacon site status in August 2023. So I'm just going to quickly just give you an example of one of the things that we've done, which is a SusQI project. So Monica led on this. In a nutshell, there was lots of single-use plastic being used, single-use paper pots. Monica co-delivered this project with patients on the ward. It's on Kimver ward, which is our eating disorder unit. She did observations of the medication round. She gathered ideas from patients and staff, and the patients and staff came up with ideas for improvement to ultimately eliminate single-use plastics and paper cups, and also reduce the amount of water that was being wasted through the process as well. So you can see the results there on the screen, and the award that we were finalists for. But yeah, so ultimately it increased patient empowerment, made staff happier, as well as impacting on the finances and the CO2. So I'll hand over to Jo now to talk about the next steps, what we've done since then.
Thanks, Helen. So the next steps, I think as well to say, is part of that early development and establishing sustainability and QI in the organisation. One of the key things we decided was that all QI needs to be SusQI, and we don't do SusQI projects, because to start with, we're using this language, oh, is it a SusQI project? And actually we felt we need to make sure that all QI projects are SusQI, that it's a standard. So from when we went on from there, we'd already been developing a top-up module for those who had already undertaken QI training in the organisation. So we finalised that, and we delivered live sessions to our currently trained staff. We got about 80 people on these, which isn't a high proportion at all of our currently trained staff. However, it did show to us that we've got a lot of work to do to engage our staff. And I think from some of the reasons why people attended today, that engagement seems to be a key theme for people about how do we do that. We haven't got all the answers, and we're still working through that, but we know it's a journey. It's about getting people at the right time when sustainability and environmental sustainability is in their minds, and ensuring we're there ready to support them when they're needing that. But what we did see from that, though, we saw some of our key leaders in the organisation joining those sessions, which is really, really important. And again, it's something that we're continuing to work at, is how do we get that leadership understanding, why we need to do it, what questions should they be asking their teams about their improvements to ensure that the triple bottom line is considered. We'd also, in the organisation, had a sustainability impact assessment developed. So this was led by the Green team, but we were very involved in this development. For us, it seemed like a really core practical support mechanism for staff to move from the theoretical, great, think about your environmental sustainability of your improvement, to actually how do you do it. I'll show you, I think, hopefully I've got the slide on here to show. So this is just an example of it. It's a quick screenshot. So it just asks loads of questions about the environmental, social, and financial impact. For me, I thought this was a great tool because it's things you wouldn't think of, especially the environmental part. So if you just ask somebody, does it have an environmental impact, your improvement, a positive or negative one? They go, oh, no, I don't think so, and then move on. But what it does here is asking particular specific questions that really gets you thinking about that. And the same for the social and financial part. And then what it does is it then creates a summary of the sustainability sort of impact of that improvement. First of all, is it a positive one? Is it negative? So as I say, the Green Team developed this where we supported and we moved and made sure it was in a place that all these sort of submissions were visible in one set database. So the Green Team and even ourselves could look into it to make sure we're seeing what where support needs to be more proactively. And we're making sure that that's sort of tied into all of our QI work, that it's a key tool that people should be using. So, let's go again. Sorry, my slides aren't moving. Helen, can you move them? There we go. Thank you. Yeah, so that's a sustainability impact assessment. So what we've been finding is getting some really core tools that move from that theoretical to the practical applications being so important for us. So there's actually tangible things that people can start using. Also, as a team, we undertook carbon literacy training. So we know that we need to develop our own knowledge in environmental and carbon sort of literacy. So we've all done that. And Helen had undertaken the leadership aspect, where the rest of the team have been doing the sort of standard training on that. And that has been really useful just to support our confidence when we're talking about the environments, particularly when we're introducing this through training and just general day-to-day conversation. One of the other tools that we have developed, so back in the end of last year, we started doing a stock take of our continuous improvement, quality improvement offer in the organisation, just to see, is it fit for purpose? Is it what the organisation need? What came to light very clearly on that is that there's loads of improvement going on in the organisation, but we just weren't seeing it. We're seeing some of the bigger sort of ticket items and big programs of work that we're directly involved in, but there's so much sort of hidden away that we just weren't seeing. So we thought that was a really good opportunity to develop something for people to just track any improvement, from the small things to the big things, but building in sustainability and QI across all improvement work, even if it isn't using particular quality improvement methodology. So within that tracker, we've got a question about what is the impact across the social, the environmental and the financial aspects of the triple bottom line. And so it's just prompting people to think about it. We haven't had loads of people complete the environmental bit yet, but that's doesn't matter so much, because it's asking people, it's ready, it's there. We're supporting people to consider that. So it's things like that, again, that we found really useful to do, is those tools that people are using on a day-to-day basis that is baked in from the start. So something to take away is what can you do to sort of make sure that's there, present, and not an afterthought, and it's alongside everything else we're doing. Things like the Green Awards being released in our organisation has also really helped, again, connecting the two. So if you're undertaking improvement projects and you've managed to consider the environment as part of that, it's getting that as evidence towards a Green Award. So again, some of these tangible benefits for staff and recognising the work they've done towards that has been really, really important. We've also been doing some specific training with newly qualified staff, and that's been really exciting, actually, because it's a new generation of staff coming in where we've got an opportunity to embed this from day one. So for a lot of people, they've been in the NHS for many, many years. Trying to overlay the environmental sort of considerations is going to be a lot of a longer journey for us, and one we need to continue at. But for new staff, everything's brand new. So building that in from day one is really good. And the conversations we've had to date have been really positive, and people have been really excited about that. And we've generated sustainability champions out the back of that and things like that. So that's been a really useful sort of addition. We've also then more recently developed the SusQI on demand material. So as I say, our live sessions captured a very small percentage of the organisation who've been trained. So we've then thinking about how else can we engage our staff with this new additional sort of change in how we're approaching our quality improvement projects. So the on-demand material is going to be helping staff just do it at their pace when they're ready, when it comes to mind, something we'll continue to promote through team meetings and other places that we're at to encourage that. So we're hoping that through these different avenues, people are having different opportunities to be considering the environmental, social and financial impact in all the changes that they're doing, but also meeting them at the place that they're at. So not trying to force it and push it so hard that it actually turns them away, but really trying to come alongside them, getting to think about it, but making sure that the material's there ready for them. And then we've left in there, continue listening to staff. That's going to be so important for us to make sure that we've got the pace right. I think in 5 years' time, we will be in a very different place in terms of what we're asking staff to do. We might be a bit more prescriptive about completing a sustainability impact assessment for everything. We're very strongly recommending it, but we might have to move to other measures as we progress. So listening to staff, seeing, are we getting the pace right in terms of what we're asking them to do? Can we move them on even more than where we are now today? Has been really important as well. So next steps for us, as I mentioned, we did a continuous improvement stock take. So we're going to continue to follow that through, making sure that sustainability and quality improvement is continually embedded within all of those improvements that we're looking to do. The broader staff awareness continues to be a big piece of work, and that's going to continue for many, many, many years to come. But we continue thinking about new ways of engaging people and making sure that we're having the opportunity to speak about especially the environmental aspect in any opportunity, any forum possible. Being more integrated with the green agenda, we are already tightly integrated with that. So as Helen mentioned, we're part of the strategic sustainability group. And again, a bit of advice that if you can get to that sort of more high level green agenda sort of conversation from a quality improvement perspective, it's going to be so beneficial to see what else other people are doing and how can you keep on being engaged with that. But we want to keep being on that journey and being more and more engaged as much as we possibly can. The developed senior leadership understanding is something we continue to struggle with and we continue to work at. But that's going to be really important, as I say. So we've got our senior leaders asking the right questions. They might not be undertaking the improvement, but making sure that they're asking the right questions, including the environmental, social and financial impact of improvements. Supporting staff as well, making sure we're getting much better at our carbon calculations. We are, I think, getting a lot better than definitely from day one when we just can figure out what on earth we're doing. So I think we've got a lot more confidence there, but we want to make sure that we're getting better and better at that and being able to support staff and the education on how others could do that. And then thinking more widely about others in our integrated care systems, how do we support them to move forward in their thinking as well? That's really important. And we're working with our partners on that, creating spaces for people to share where they're at. And for us, again, to have a bit more connection with them and sharing our journey. And then making sure our messaging is consistent across all of our clinical and practice networks to make sure that the same message about our improvement approach is being disseminated in those areas, which is going to have a lot of impact. So I'll hand back over to Helen to wrap up this part.
Thanks, Joe. So we've alluded to some of these challenges that we've had and are still having in some cases, but just to go through those with you as well. So how we move from theory to practical more widely is a challenge, but as Joe said, we've got the sustainability impact assessment. We've also got an improvement tracker, which prompts people to look at the triple bottom line, which is helping us with that. We're hoping that the carbon calculations demand is going to become more of a problem for us and that we need to think of a solution. Currently, everybody that needs some support with those calculations, we're signposting to the green team. But as I've said, they're a very small team, so that can't be the only way of supporting people going forward when that demand increases. Consistent understanding from leaders we've talked about, and encouraging leaders to lead by example with their environmental sustainability. So things like seeing leaders with reusable products and using more sustainable travel will certainly help influence others to do the same. So key takeaways from us then: engage with your green team or equivalent in your organisation. Take ownership early on. If you're the QI team, grab it with both hands. Make sure that all QI is including SusQI, not to look at the two things separately. Integrate the environmental aspects within your core QI training. Focus on the small steps, not the big milestones, so it doesn't feel overwhelming. Keep asking the same questions. That really, really helped us. And bring key stakeholders on the SusQI journey with you. Don't think that you've got to do it alone. Involve others. So I hope we've kept to time, Kath. But if there's any questions or people want to look at our internet site, then it's on the screen for you there.
Wonderful. Thank you so much, Helen and Joe. That was super helpful. I'm already doing it, but if I was going to say, if anybody wants a 30-second kind of stretch out before we listen to the next presentation, do that. And as you are, I was just going to point Helen and Joe to have a look at the chat, because there's lots of kind of questions in there. Everyone keep adding questions in the chat, and there'll be a chance to voice questions for all of the presenters later. I was going to just highlight one question was directed at Joe, but kind of for both of you. There was a lot of love for the sustainability impact assessment in the chat, and there was a question about whether that's something that you're able to share. So if you could either answer that or put a note on the chat, or let me know afterwards, that would be great. And I can also see lots of other useful resources and links in the chat, so we will save that afterwards, and we will add some of those links to our resources that we share afterwards. So thanks everyone for being so active and generous in the chat, and any of our presenters or anybody else, feel free to answer and keep that live and active. So for now, before we go to our break, because time is racing along, I want to invite Faye and Caroline to join us on the kind of main stage. I think, Faye, am I handing over to you first?
Yes, thank you.
Thanks.
And I'm really hopeful that Caroline is back in the room, because I know she was having a few technical problems in the middle of the MPFT's presentation, but we'll get started, and I'm sure that she'll join us, and if not, then I'll just take
Hello.
over those
Sorry,
parts.
I'm
Oh,
here.
you are. Good, great.
Yeah.
Thank you. Okay, fab. So yeah, thanks everybody, and thanks again to CSH and the Q community for inviting us to come. So we're joining you from South Warwickshire University NHS Foundation Trust. We refer to ourselves as SWIFT because it's a bit of a mouthful otherwise. So feel free to do the same. So I'm Faye Kenning. I'm the Service Improvement Manager at SWIFT, and I'm joined by Caroline Lloyd, who is our Sustainability Officer. So to give you a little bit of an idea about our trust and what we do, we're an acute and community provider with around 5,000 staff. We have a base at Warwick Hospital, but we have other hospitals in and around the area as well, including Leamington Spa and Stratford. And we have various other bases throughout the county. We care for patients in our communities from Nuneaton all the way up in the north. So this image in the middle kind of shows all the way down to Shipston in the south. And in terms of how many patients we see, we have over 2,000 attendances at A&E each week, around 3,000 births per annum, and around 120,000 community therapy contacts per annum. Oh, there you go. It does work. Okay, great. So again, to give you a little bit of background information then about why we're here and what we're doing. So we use QSA, which is our chosen improvement methodology, and we've been using that since 2019. And it pulls together a blend of tools and techniques from various other methodologies. So it kind of draws on aspects of lean and demand and capacity and lots of other bits and pieces in there, which is why we really like this as a model. We're part of a foundation group, which is a provider collaborative. So we share a chief executive and a chairman of the board, but we all, as our own individual trusts, you can see hopefully on your slide that there's 4 specific trusts within our foundation group here. We all manage to keep our own unique identities within that. And 3 of those trusts use the QSA methodology as well. But that being said, improvement is high on the agenda for all 4 of us under the guidance of our shared chief exec and chairman. And Glenn Burley, who is our chief exec, advocates that improvement is everyone's business. And he sets the expectation that everyone has a part to play in improving outcomes for our patients and communities and making our organisations even better places to work. And that's really demonstrated, I think, by the final image, where our 6 strategic pillars are outlined around the outside here, with the 4 main priorities. We call them our big moves in these quadrants on the inside of the circle. And you can see from that alongside improving quality and productivity, sustainability is also really high on our priority list. And we do have, as well as the service improvement team, small though we are, we also have a small sustainability team, and Caroline is going to talk you through some of that team's work, and also then the work that we've been doing with the Centre for Sustainable Healthcare to become a beacon site. So I'll hand you over to Caroline.
Thank you, Faye. Great. So hopefully, sorry, just trying to move the slides along. Oh, there we go. No, too fast. Sorry. Great. So hopefully you can see that now. So just the top fact at the top there. So the NHS emits around 4% of the country's carbon emissions. And so that's one of the reasons why we care within the NHS, because we emit so many carbon emissions, and that exacerbates numerous health conditions. I'm really sorry that it's quite noisy, if any of you can hear my background in an open plan office. But NHS England committed to net zero by 2040 for the emissions that we directly control, and 2045 for emissions that we influence. So that's things like supply chain and transport emissions. At South Warwickshire, there are 2 of us in the sustainability team. So it's myself and my manager, Chris Collegia. We support and lead on various projects across all areas of our green plan, which is shown in the diagram on the left-hand side there. So it includes large-scale estates projects to decarbonise our energy supply, managing our car share offer and bike shelters to reduce our transport and travel emissions, and engaging with staff through the Trust Induction and our Green Champion network. We have around 80 Green Champions at Swift, and these are enthusiastic members of staff who've introduced sustainable changes in their workplaces, including projects around reducing paper, other supplies, to switching to reusable equipment. So I've got a couple of examples on the slide here. So the teams who've digitalised their paper formularies used by community staff, preceptorship workbooks, and also patient forms. Our fire team have also recently reduced travel emissions relating to their training sessions, and they now visit community sites to deliver their mandatory fire training, whereas previously we would have had around 25, 30 staff coming to one of the hospital sites to receive that. So if I move on, so South Warwickshire Sustainability and Service Improvement teams have worked closely with the Centre for Sustainable Healthcare. We've attended CSH training on SusQI, teaching SusQI and carbon accountancy, which has helped to embed our understanding of the environmental issues caused by the healthcare we provide, providing us with examples of how other organisations have made sustainable improvements, and help to demonstrate how we can measure the impacts our improvement projects might have. We last year set up a Green Teams competition, which supported 6 Swift teams with their improvement work to be able to provide our own examples of sustainable improvement projects and to inspire staff. The CSH supported each team and provided numerous improvement tools for the team to try. And I'll talk through a couple of the projects in a few seconds. And finally, we worked together to identify other processes where sustainability should be embedded. For example, ensuring there are prompts within our template forms asking people to consider the sustainability impact of their work. This included project registration forms, business cases, and signposts to advice and support. Skipped ahead again, sorry. So I've included a couple of projects here, which were delivered by the teams as part of our Green Teams competition with the CSH last year. So this project was delivered by the Frailty team and was our winner of the competition last year. They ran an awareness and education campaign with staff across several frailty wards with the aim of reducing unnecessary blood tests. This had benefits for patients' skin, which is often quite fragile due to their age, and also improved discharge times where patients may previously been held for results from tests which weren't necessarily necessary, so helping to get more patients in to be seen. And you can see there the various different savings. Our finance team is particularly happy with this one, with just over £18,000 a year savings. So a second example, this one's ongoing actually. They've been moving into different brands of insulin pens, but our diabetics, dietitians and nurses introduced reusable insulin pens for suitable patients, which helped to reduce the waste created. The pens also keep track of the last dose, so the amount and the time that it was received. And this allowed for some patients who needed 2 doses a day to give themselves one of them. And the clinical staff member could then arrive to check it had been delivered and to administer the second, giving those patients increased independence and freeing up clinical time. Patients who remained on the single-use insulin pens were encouraged to use the recycling scheme available. So the team also measured the environmental and financial impacts of that. And so our combined Green Team competition projects had annual savings of 7,000 kilograms of carbon dioxide equivalent, and also financial savings of over £100,000. We're carrying out a second Green Team competition this year across the ICB with 3 other trusts in Coventry and Warwickshire. Thank you. Over to you, Faye.
Thanks, Caroline. I'm not sure if I've got control of the screen now. Maybe I have. Let's see. Okay, so as we talked at the beginning, one of the things that we've been working really hard at over the last kind of 18 months is to embed sustainability into our improvement methodology and our teaching for all of our staff members. So this, if you're not familiar with CUSA, is what they call the CUSA flower. So it has these 8 modules, and each person that goes through one of our programs will go through each of these different modules. It uses the model for improvement as a framework as well. And so when we do our introduction to CUSA, we run through that model instead of using these 8 modules instead, because it's a much shorter session. But CUSA itself is an accredited program, which draws on all of those tools and techniques that we talked about earlier. But what that meant is that it was difficult for us to change the content, particularly without kind of coming a little bit unstuck with those that have created it. So what we did need to do is then just add some information in instead. So we worked with the CSH to embed sustainability into all of the different levels that we offer in a way that makes sense to our staff, but doesn't take away from that programme content, so that we can still ensure that we are offering accredited programmes. And we practice what we preach. We used a PDSA approach, making small changes as we went, and assessing the feedback from participants and also the teaching faculty before we made any further changes. And as such, it's actually still a work in progress, continuous improvement, as you know, it doesn't stop. And so it's definitely not a final product as yet, but we are definitely seeing some benefits in using it. We spent some time considering how much detail we should include at each of the levels of the programme that we offer, really what it is that we want people to take away from attending, what it is that they need to know. And we wanted to give attendees some examples of how other people have made improvements with environmentally sustainable projects, to give them the opportunity to think about how they could come up with their own. But we also wanted to highlight that existing improvement projects that they might be involved with will also already have sustainable impacts that perhaps they hadn't considered or hadn't acknowledged. And so this will just kind of run through some of the things that we've done, showing how we've embedded it into each of these different modules within the programme. So to start off with, we do an orientation session, and within that we talk about environmental sustainability as an underlying principle throughout improvement at Swift. And then when we talk about leading improvement, we look at the 7 domains of quality, and I think Kath shared that image earlier. And so that just gives some context around the link between environmental sustainability and healthcare. And then when we talk about project management, we give an example of one of our Green Teams competitions. And because it's from Swift, I think it's particularly useful for our staff to see that we're doing it already. And it just demonstrates how they use the model for improvement to make their improvement. When we look at measurement for improvement, we provide information on measuring sustainable improvement, and we also offer up a driver diagram that shows how you can increase sustainable value. And when we come to our sustainability and improvement module, we had quite a bit of debate on this one within the faculty, because obviously the word sustainability is already used within the programme, but it refers to the longevity of projects and how long they continue for after you've completed your project. And actually now we're also introducing another meaning for the word sustainability, where we're thinking about environmental impacts. So we just kind of offer that definition, or the 2 definitions, to make sure that people are really clear that when we talk about sustainability, there's different aspects to that we need to be thinking about. When we looked at engaging and understanding others, we're thinking about our stakeholders and who else is involved in our improvement. And we added a reference to our sustainability team. So a really easy one for people just to think about, well, actually, what are the sustainable impacts? And if I need some further support and advice, who can I go to? When we look at creativity and improvement, we added a breakout exercise for our participants, which encourages creative thinking and using encouraging creative thinking using improving environmental sustainability as a constraint. We're going to do that in a minute, so it will make more sense then when I can get my words out. Process mapping, we added an example demonstrating how this can help to reduce wastes in our services. And then finally, when we come to demand and capacity, we added the principles of sustainable healthcare. And on top of this, we've also developed a standalone course, which we've done that to ensure that the people obviously that are going through the programme now are receiving all of this additional content and gaining that understanding of sustainability. However, everybody that has been through the programme before has missed that opportunity. And so we're going to offer up this standalone programme for all of those who've already been through it so that they can ensure that they're caught up and they have the same level of knowledge. So just to show you a few of our slides where we've embedded improvement, we talked about the 7 domains of quality, where we have sustainability in there, and we talk about how all of the domains are interlinked, and prevention obviously also needs to be considered as well. We talk about the climate emergency and how much of an impact healthcare makes on that. We talk a little bit about where those carbon impacts are, and that helps people to start to think about how that might affect the work that they're doing and what changes they might start to think about making in their services. We talked about the driver diagram. So here we kind of use this as a dual purpose slide. So we teach how to use driver diagrams in our measurement module. And so we have this one in here as an example, but it's also actually talking about how we would improve sustainable value. So we've kind of got that in there, doing 2 separate things for us at the same time. And similarly with this one, we teach process mapping, or we kind of help people to understand how to process map. And this example of a process map actually works through the ecological, social and financial costs of each of the different steps. And so again, it's kind of serving a dual purpose in there, showing how to do the process mapping, but also how you can apply it in a sustainable project. And then this last one is just those principles of sustainable healthcare. So we've talked quite a lot. We're hoping just to give you a chance to experience one of our exercises from our CUSA programme. So we're going to try using an idea generation tool called the theory of constraints. So Stravinsky said the more constraints one imposes, the more one frees oneself, and the arbitrariness of the constraint serves only to obtain precision of execution. So essentially, he's saying that sometimes when we're trying to think our way to new solutions, the sheer number of possible routes that we can go down means that we struggle to get started. And so it can help to impose a constraint where we restrict our options a little bit, and that helps to give us some focus. So what we were hoping to do then is to show you how we do that in our creativity module. And so we're going to use transport as our constraint. So transport to and from our sites accounts for 12% of our total carbon emissions, and Caroline's briefly talked about some of those issues a few moments ago. So what I'd like you to do is, using transport as a constraint, to brainstorm some ideas for lowering our carbon emissions. So if you could pop your thoughts into the chat, I'll give you a few minutes to just think about that. When we do brainstorming, we have some rules in place. So we encourage unusual and wild ideas. We say that there are no bad ideas at this point, so we want to encourage all of our ideas. We defer any judgment on those at this point. We don't rule anything out. We want to look for quantity, and we want you to build on the ideas of others. So as you're looking through the chat, if you see something and it sparks a new idea in you, then feel free to build on that and add to it, and stay focused. So I think I might have to stop sharing so that I can see the chat coming through. So I'll give you a few minutes to do that. Oh, I think I can see it. Hang on. Okay, I found them. Right, so we've got car sharing, bike hire, using Teams where appropriate, video consultations, promoting cycling schemes, using e-bikes, telemedicine, drone deliveries, buy all staff walking boots or bicycles, bundle items that are getting moved from site to site and plan how people and things are moved. Electric trams between sites, loads of ideas coming through. So hopefully you can see that it doesn't take too long if you've got a large group of people. This brainstorming technique and having a constraint in place really helps you to start to think about all of the different ways that you might be able to make a sustainable change. And obviously you've got access to the chat afterwards. So if there's some good ideas in there, then feel free to take those away and prioritize those to make your own improvements. But I think the real aim of the exercise for us is to demonstrate that we've not actually made a huge change to the way that we run our CUSA program. There was already a constraints exercise built into this part of the program. All we've done is change the constraint to encourage people to think about making sustainable changes. And you can do the same with whatever improvement methodology you use. So for us, our next steps are to share our work. And obviously we're doing that here today, and we have already shared at other CSH events as well. And we are working closely with Aqua, who actually control and manage the CUSA program, to embed sustainability into the National CUSA Practitioner program. So that's the highest level of the program. And our faculty members are part of the working group to create a brand new module for that program, which will hopefully be available and up and running next year. We're continuing to develop our offer. The standalone course that we've built that we talked about is being rolled out, and the first session takes place next week. So we'll obviously be reviewing the feedback from that and using PDSA to improve it even further. And as Helen and Joe were talking about, we also look at our newly qualified staff. So we have preceptorship programs, so that we're thinking about how we can develop more grassroots improvements through that program. So we've got that we're working on as well. And then one of the big things that we need to be able to do is to demonstrate the impact of adding in and embedding sustainability. So we already distribute a follow-up questionnaire 6 months after completion of our CUSA programs. So we'll be reviewing the data from that to see how people have managed to put their knowledge into practice. And we keep a log of improvement projects which are being carried out across the trust. So we'll be reviewing that log to see if there's an increase in the number of projects which include a sustainability benefit. And having listened to Helen and Joe, we'll also be considering adding in a sustainability impact assessment, because I thought that was great. So there we go, we've learned something new already, and then generating more ideas. So we have just appointed a perinatal pelvic health service improvement manager who will be supporting Green Maternity at the Green Maternity National Competition, and we'll be supporting the Centre for Sustainable Health and Sustainability team with our ICB's Green Teams competition, which is due to begin in 2025, and we'll continue to advocate and promote our training. And I think that's us finished. So thank you ever so much, everybody, for listening.
Thank you, Faye and Caroline. We are running over a little bit, so we're going to go for we're going to have a break now. Do keep adding questions in the chat if they come to mind, and any of the teams, please jump in and answer questions. I'm just going to direct you particularly to the one that came in from Samantha at 1416 around the number of staff in teams, so that would be great to answer that. So we'll come back at 2:30 start. Welcome back, everybody. We have one more presentation, one more journey, story, progress to share with you. So I'm going to hand over to Nick and Kate from Cardiff and Vale University Health Board to take you through the next section.
Hi, good afternoon, everyone. Thank you for having us.
Hello.
I'm Nick Tyson. I've been with the Health Board for since 2010, and my role has been developing quality improvement skills. And over the last few years, it's been a bit of a journey in, like all the others, around incorporating sustainability into our quality improvement training.
And I'm Kate. Great to be here. Thank you, everyone, for having us. So I work as a service improvement manager in the same team as Nick, and I've got a clinical background as an occupational therapist. Similar to Kath, work predominantly within mental health, and then I found myself in the improvement world a couple of years ago, and have a personal interest in sustainability, which has led me to this work that I'm involved in.
And just to sort of give a context to the organisation, we're a very large organisation with about 17,500 staff, and we deliver services to primary, secondary and provide tertiary services for all of Wales. So a huge sort of organisation is a big part of that. So let's hand over to Kate to just introduce some of her background.
Yeah, so we're just going to take you through a little bit of the context here in Wales, and we've got some examples to share of what we've done in terms of embedding quality improvement, and then some of those projects that we've got locally here. And then we're going to take you through our sustainability assessment tool as well. So just to get us started, to kind of echo what Kath was setting the scene with at the beginning. So climate change is one of the biggest and fastest, most enduring threats humanity faces. Here in Wales, we're already seeing the impacts of climate change with wetter winters, warmer summers, and more unpredictable weather patterns. And this will continue to become more obvious over the coming years and decades. Cardiff is actually in the top 10 most at-risk cities globally for flooding as well. So we feel particularly in danger here in Cardiff. So in 2019, the Welsh Government declared a climate emergency. So this signalled that Wales was committed to tackling the challenge of climate change. In response to this, the Welsh Government stated its ambition for a net zero public sector in Wales by 2030. NHS Wales is the second largest public sector emitter of CO2 after our local authorities in Wales, with our carbon footprint being equivalent to almost 126,000 homes' energy use for an entire year. So within Wales, our Net Zero Wales plan sets out how the second carbon budget from 2021 to 2025 will be achieved, and the plan outlines 123 policies and proposals across all of our ministerial portfolios. The focus is now on delivery of Net Zero Wales, and actions have already been taken to get us there. So Nick and I wanted to share just a few events and examples of networks that we've got within Cardiff and the Vale and across Wales in terms of sustainability. So the first of which being the Green Health Wales network. It's an all Wales network for professionals and organisations to make health and care services climate smart. Next week, we've got Wales Climate Week. So this is an annual opportunity where we have a national conversation on climate change and engage with a wide range of stakeholders. The week this year coincides with the United Nations COP29 climate change conference, and it will provide an opportunity for climate decision makers, stakeholders, community groups, and people across Wales to explore how together we can minimise the risk and prepare for the impacts of climate change. So we've shared a link to this in the resources because it's a full virtual programme for the week, which we wondered whether people would be interested in. So you'll get that in the resources. The Climate Emergency Spread and Scale Academy is an innovative initiative commissioned by the Welsh Government's Climate Emergency Programme as part of the Wales Climate Week. This academy is all about turbocharging sustainability efforts in healthcare across Wales, Earlier this year, we celebrated teams at the All Wales Healthcare Sustainability Awards. The teams that were shortlisted for these awards are now part of this academy, where they will be learning new strategies to amplify their sustainable improvements and innovations far and wide. It's all about sharing the love and green practices with as many people as possible. We've included some brilliant examples of the projects attending in the shapes that you can see on the slide there. Currently, there's training dedicated to climate smart champions, and this is open to all colleagues at all levels of the NHS. A climate smart champion is someone who will lead on transforming NHS Wales into smarter, more successful and more sustainable organisations. And Nick and I have recently worked with the Centre for Sustainable Healthcare over the past year to support our team to become an established beacon site. And this has involved work over the past year to incorporating SusQI into our improvement training that we offer as a team to the organisation, which Nick will tell you a bit more about.
Yeah, so it's been really interesting because, as the others have said, we wanted to not change everything. We wanted to incorporate the sustainability and the SusQI elements into all our training across the piece, because it was coming up in conversations. People were looking to do improvement projects in that space and finding those challenges anyway, and we had lots of conversations about it in the training, but also we had a really well established quality improvement training offer across the whole University Health Board. And so to incorporate it was really, really important. And the support we got from Centre for Sustainable Healthcare and Cath was fantastic in making sure we had the right elements in there across there. So what we started with was actually with our most comprehensive programme, which is our Improvement Practitioner programme, in which we aim to take people into a full leadership role. An equivalency, some of you are out there, not quite an improvement advisor because it's very improvement heavy, but it's a huge amount of content around all the skills someone might need to lead an improvement project. But what we wanted to do is for those leaders of change and improvement to be able to help people identify drivers for change that include sustainability, to use the tools and techniques that they're already using, from process mapping to fishbone diagrams to measurement tools, and using some of those brilliant tools around that we saw just in the previous visit there, that people can use in their day-to-day work when they're making improvements and change. And actually, in using some of the changing some of the exercises that we do in that training, and actually using sustainability as the sort of the hook to hang it on, because actually it makes the conversations much more brighter. And then what we've done then as the highest level, we have then taken, okay, when we go to our smaller courses all the way down to our Change Basics, which is an online learning, self-learning using Microsoft Forms, where people can watch some videos, answer some questions, and it gives us to ensure people have that sort of language and literature of change and improvement, but make sure that we include sustainability within that. And then in the middle hour, what we call team-based problem solving, which is our sort of allowing all teams to be able to do change and improvement from that point moving forward. Our next steps, because as a change team, we're not just an improvement team, we are the shaping change team, as you can see by there if you're looking on the screen. We also hold the ball for project management and programme management within the University Health Board, as well as innovation within the Health Board, and also the leadership, which Kate was just mentioned around. We deliver some of the key leadership programmes within the Health Board and across Wales. So trying to incorporate that into there. So the next step is to incorporate the SusQI principles and some of the tools and make them relevant for project management. And also we're developing new measurement for improvement training and including some of those measurement tools within that. So that's been a brilliant journey, and people are really relishing that conversation within that space.
So we wanted to share an example of a sustainability project locally, so the nitrous oxide project. So in Cardiff and the Vale, we've pioneered a sustainable healthcare solution by installing a nitrous oxide cracker machine in the maternity unit. This is a brand new technology that was developed in partnership with industry, a firm called eBreathe, using Welsh Government Small Business Research Initiative Challenge funding. So this innovative technology breaks down nitrous oxide, a potent greenhouse gas, into harmless nitrogen and oxygen after use, and significantly reduces the healthcare sector's carbon footprint. In fact, the emissions for Entonox, commonly known as gas and air, represent about 75% of all of the carbon dioxide equivalent from anaesthetics in Cardiff and the Vale Health Board. So the project was initiated as part of a broader effort by Cardiff and the Vale Health Board and wider NHS Wales systems to make healthcare practices more sustainable. Following the successful shutdown of nitrous oxide manifolds in the University Hospital of Wales, University Hospital of Landock, and other parts of Cardiff and the Vale Health Board estate, the team attended the Spread and Scale Academy, and the Academy's collaborative approach enabled a diverse team of clinicians, pharmacists, estate managers, and engineers to come together to tackle this problem, learning tools for scale. Through the Spread and Scale Academy, the project team shifted from thinking about the problem and thinking about the problem, not the solution. Their original project was to shut down the leaky nitrous oxide manifolds, which they successfully did and have spread to other organisations across Wales already. The successful implementation of this technology demonstrates the potential for significant environmental impact reduction within the healthcare sector. Its success is anticipated to lay the groundwork for wider commercial rollouts and collaborations beyond Cardiff, aligning the NHS and the Welsh Government's overarching sustainability ambitions. Another project that we wanted to share with you as an example is we've, in the last year, been working towards launching a Gloves Off campaign in Cardiff and the Vale. So there's a number of reasons why we would want to reduce our use of gloves, including, and what we have found to be probably our main driver within this project, is the environmental impact, as gloves are a significant source of plastic waste, contributing to pollution and environmental degradation. And reducing their use can help minimise the NHS's carbon footprint. It's important to note that gloves are still essential in many healthcare settings, particularly when there is risk of exposure to bodily fluids or infectious materials, but the goal is to promote the appropriate use of gloves rather than eliminate them entirely. There is a huge potential for improving sustainable value through this piece of work. So just to take you through on the next slide what we've done. So we spent some time at the beginning of the year studying examples from across the UK. So there's some great examples of really successful Gloves Off campaigns. For example, the Great Ormond Street Hospital campaign you might know the work of. It was a brilliant example. So we spent quite some time learning from those examples out there. We were able to form a pilot team in Cardiff and the Vale to be able to really dig into the root cause of the problem and to be able to look at the drivers. So we formed that pilot team and spent quite some time looking at the problem. We did some observations and some audits on the unit, and we've also done a staff survey within critical care that's now gone wider throughout the organisation. And we've got almost 400 responses to that throughout the organisation. So we're really pleased to, hopefully that will help us inform the wider campaign once we've piloted on critical care. So measures for this project, we're looking at the gloves ordered. So we've got a report set up where we get the gloves ordered, and from that we can look at the cost and then the carbon from that. Some other measures, so balancing measures, we've been looking at the hand hygiene audits and also healthcare acquired infections. So whether there is a positive or negative impact. And also staff wellbeing, as contact dermatitis is an issue with glove use as well. So we were able to look at our PDSAs and our change ideas. We're coming towards being able to launch one of our PDSAs, which is a communications campaign. So kind of poster campaign all over the unit, digitally, but also, you know, posters in prime positions where staff will then be able to take from that the education that they need to be able to make that decision and risk assess whether they do need to wear gloves or not. And we're really keen to get kind of really clear guidance to staff so that it's an easy decision for them.
Okay, so since the last sort of 5-6 minutes of our time, I did mention the chat to some of you, and Kate mentioned at the start, around we've been working on a tool. One of the challenges, and I think looking at the chat and what people talked about earlier, is that ability to carbon count and the convocation and like the request. I'm doing this project, how do I count that? And we've had lots of conversations around that. There are tools out there, and some of them are quite wieldy and difficult, or there are experts within the organisation who then get overwhelmed with requests to doing that. So we said, is there an opportunity to develop something really simple and really straightforward to help people, not to necessarily be the solution for the health board, but to help teams and individuals locally to be able to see the impact from a carbon point of view that their efforts are having, and also to centrally to be able to help with the things like reporting about saying, well, we've got these big things we're doing, but look at all the little stuff we're doing as well. So using the wonderful world of Microsoft 365 and the opportunities that gives us, we looked into it to have a play and gave an opportunity for us to be able to learn how to use things like Power Apps within the 365 environment. So it gives us that ability to better look at that. So we had a look around, we had a play, and we found an app on there that was designed for measuring flooring installations in office blocks, and we adapted and amended that and using information and data from the Centre for Sustainable Healthcare and some tools that are shared within that community with some data sources. We had a go at building the app. And the best thing to do is actually sort of show you the app. The calculation factors that are in there are many of them, and we're always adding to them and trying to update them. And so when people put in their information into the tool, it's giving them relevant figures back. That's really useful to give them that context. So let's share the tool. So I'll do a quick show. And what might be useful is, while I'm showing you, if you wanted to, when I build an example, if you wanted to think of something you wanted a carbon calculation for, pop it in the chat. If I can see it, I will try and incorporate that in what we're doing. So hopefully this comes up. Sorry for that. Share. So has the right thing shared for you? Bear with me, sorry. There we go. So you can Vicky, can you see the tool?
We can still see the thing that says calculation factors.
Oh, okay. So it's not sharing the update. Okay, let me just I will get there now.
It might be helpful to stop sharing the slides and then reshare. It's coming up now.
Yeah, there we go. Fantastic. That might work. So it's a tool that sits within Microsoft Teams, and so people can use it on their phone, and it enables people to go in and build their own assessments. So here's an example of all the test ones that we've been sort of playing with. So you can see there's loads. These are all tests. It's very early in its development. But if someone simply has a project they're doing, they can just create a new assessment. So what they do is they put the name of their project. So it could be we'll call it the Q visit for today. From that point of view, put their name in there. So this is about information. I'll just put Nick. Very quickly, it doesn't matter what I put in here, but I'll put Nick at Wales. It's not my email address, but I'll just put that in there. And we're from the Shape and Change team. So this is for them to just keep a record of all their different projects. And they can create an assessment. So it just takes them very, very quickly into a tool that they can then start building their assessment. So in there, then all their assessments will be there, and it'll be a nice new assessment for them. So there's the Q visit. So we can go and build up our assessment and do an assessment. So all people simply do is they might have done their mapping, they've done their fishbone diagrams, they've identified opportunities where there could be a carbon input. It could be transport, it could be use of gloves, it could be use of anaesthetic gases, it could be procurement, all the things that we know that are happening in that space. So we can they can choose those categories. They have to still go and measure how much of that they're using, but they can do that. So it might well be something like travel. There was an example earlier on around travel, they can call it. And all they simply do is select the category. So in this case, they're going to look at the travel area. and in there are some sub areas. So they're looking at the amount of car use people having, so they tick that. They then put in what they've assessed as the current monthly usage in kilometres per car. So they, because of the travelling and back and forth to clinic, they currently have estimated or done an assessment that there's currently 2,500 kilometres of travel being used. They're looking to deliver the service online or with video, apart from any essential delivery. So they said, well, actually predict they're going to have a 4/5 less people attending. So they reckon it now would be only 500 kilometres. Straight away, it gives them the carbon impact, and then as a result of the change, and then the impact that they're having. And they add that to their project. Once that's in, they might think, well, actually, some people use the bus, so they can absolutely pick another category and say, let's look at the bus travel, and then put passenger kilometres. Not so many use those, so they might be currently 800. Less people will be using the bus, so there'll be 200. And then it gives the figures for their add to the project. They might have a different category that they might want to use, so they might be sort of procurement, just to show you the sort of range of stuff that's in there. And this could be added to. They pick their category, so medical supplies. Again, a huge amount of stuff they're using. So they'll end up spending less money on staff clothing, for example, because they're operating from home, what have you. So they're currently spending. Just notice the units change depending on what they're using. So they're currently spending £1,000 a month on clothing, and they're going to reduce that down to £800 a month on clothing, and so on and so on. So they can build up their entire project here, and then it gives them then their total potential carbon saving per month as a tool. And then they can submit that assessment as a lock, and it locks it, or they can leave it open to add stuff as they're doing things with that. And that's it in a nutshell. So in our time to do that, and if I just quickly so the next step to it is very early. Is our first step is to share it with the entire health board, and what we're then looking to do is to spread and scale it. Kate mentioned the Spread and Scale Academy. There's one next week. It's going to that academy with views to how do we spread and scale it, firstly across healthcare in Wales, then across public services in Wales. But beyond that, if we can find a way of sharing it with everybody, we will, because we're not precious about it, because it's a useful tool. So hopefully people find that useful. And if you have any questions, pop them in the chat, or by all means in the panel in a little while. Happy to do that. So thank you very much. Yep.
Thank you so much, Nick and Kate. There is a lot of interest in this app in the chat. So spread and scale far and wide is it looks like there's demand for it. I think there was a specific question about which app, the app that you mentioned that you adapted.
Yeah, so it was in Power Apps. They've got a load of templates, and there was one in there in the Canvas apps. It was one for flooring estimates. So it was that. It got you. There was no security on it, so we had to add in and learn the code in the background to be able to do it. And so and it runs off Excel in the background. It doesn't use tables. So if there's some clever developers on this call than I am, because I'm not a developer, I'm sure they do a far better job of it. But more than happy to have a conversation about what we did.
Brilliant, thank you. Well, for now, we're going to go into breakout rooms. I think Julia's got them all set up. We'd love you to just share between you what stood out for you in the presentations that you heard. I think if we could, have you got if I just pop the reminder of Kath's questions that she posed at the beginning in the chat, you might want to have a look at those. Also try and come up with your priority question for the sort of panel for everybody in the next about 12 minutes in your rooms, so that we can take some of those questions that people might still have remaining, and when we come back into the main room before we close. So Julia, I think you have some rooms ready for us.
I'm going to open now, and
Welcome back, everyone. It's always a good sign, or maybe a sign that we should have left the rooms open a bit longer when people are talking right up until the last minute. We were keen to give you all a chance to kind of share reflections or questions in these last 15 minutes. So what I'm going to do is ask you and anyone pop a hand up or jump in if you've got I would like to invite you to share a reflection from your room and or a question for our lovely hosts and speakers. So anyone who wants to share a reflection or a question, please go ahead.
I'm happy to share from our small conversation. We just reflections really. We were taking away this message about making sure that we just weave this into what we already do, whether that's training or templates, etc. So so there was a bit of a reflection on that. There was a lot of love for the app and how we might be able to utilize something like that going forwards, and a recognition that we could see projects that had happened where if the QI team or our sustainability colleagues had been involved early doors, we might have been able to evidence better the impact that they'd had in terms of sustainability. So just a few reflections from our group, but really great conversation.
Thanks, Lisa. Anybody else? Any reflections or questions?
Yeah, I'm happy to. Oh, Mel's there as well. So our group, yeah, very similar themes about actually, embedding into practice and developing those tools. The key, I suppose the question is how do we share that and get that accelerated? The thought and question I suppose I have is, could sustainability be the trigger to transform healthcare delivery in terms of a model? So at the moment we expect thousands of people to go to big institutes. What would a dispersed model of care look like, or actually focus on health prevention rather than health care? So it would be interesting to see some other views on that.
Right. Yeah, big systemic question. Thanks, Dave.
Sorry about that.
Does anybody want to have a go at offering any answers or reflections on that from the host team?
Well, I can say that I agree. I think, from whether it's an improvement perspective or just thinking about, obviously the NHS agenda is the focus, the big focus on prevention, but we definitely need to be thinking more upstream. And there's principles that we talked about, people not needing healthcare or the traditional kind of model of healthcare. And I think sustainability could be an active driver for that, but it's kind of, some of the things that came out of the chat as well were around senior leadership and how we engage at all levels. And I think there's so much to do at those kind of team and service levels that we talked about, but big fundamental change as well. So it would be great to kind of create more movement around that. I don't have anything more insightful than that, but just definitely agree, Dave.
No, I would agree as well, Dave. And we're not all the way there yet, but certainly that's when we were doing our work towards embedding sustainability in QI. The prevention principle for all of us went, oh yeah, actually that's what we should be encouraging all teams to do. So even though we might not be working with teams working on preventative care, actually getting to think about what can they do that changes what they do to support people. Now we do that quite a lot, don't we? There used to be the big thing around making every contact count, where even if they come for one thing, you're asking about other things. And I went to the dentist the other day and just remembered, oh yeah, now they're asking about my smoking, my drug usage, my alcohol usage, which I don't use all those things. But I think it's that we're supporting through our training is going, have a think, is there anything you can do on that preventive? But and I agree that over the time, that's where we should be investing the time in. I've got no answer to it other than we totally had the same thought and on that same sort of train as you.
Thanks, Kath and Joe. Mel, do you want to come in with your reflection or question?
Yeah, so reflections in our group were around kind of how there's all of these little pockets and silos of people that really need to join together. I'd be interested to ask the Beacon sites kind of how did they manage that join up between people in different parts of the organisation, in terms of, is it purely a clinical QI process that you identified, or did you bring in kind of estates and supply chain and all of the other things as well? And then supplementary to that is kind of, how did you get that leadership endorsement of a new way of working? Because that's one of the biggest challenges, I think, to raise the profile and the priority, given all of the very important priorities within the organisation at the moment.
Thanks, Mel. So anybody from any of the Beacon sites, perhaps either on how you join up and or leadership? Yes, Nick and Kate.
Yeah, so from a point of view of joining things up, it's actually still a massive challenge. And it doesn't necessarily it sits with some portfolios at an executive level. I think we've been lucky in the fact that it's not necessarily clinical or strategic planning or facilities and estates, but there are people in those spaces, and there have been real enthusiasts within the organisation from a clinical point of view, being driven these groups. So there's a green group that wasn't even commissioned. It bubbled up out of the organisation with that level of enthusiasm. Whether that's a sustainable, from a point of view of longevity, solution, and it needs to be better owned, is a whole other conversation. And I think that's where we're heading to. And we were just having a conversation actually in the breakout around. There were some questions earlier on around the size of green teams within organisations. And we haven't got a green team. We're a 17,500 person organisation. We have people whose roles are that. We will have an environmental sustainability manager because we're recruiting to that at the moment. We have energy advisors, we have waste advisors, and we also always have a clinical fellow whose job it is. But they all sit in different parts of the organisation, but they talk to each other because they want to. So that's our take on things.
Great, thank you. Do any of the other two? Oh, yes, Helen, do you want to come in?
Yeah, I actually put my hand up about going to say what Nick just said, and I was thinking, oh, I need to think of something else to say now. But in MPFT, we've got a similar sort of thing in terms of we've got sustainability champions. So we've got a Microsoft chat, and we've got a meeting that happens periodically about all sorts of things that come up there under the sustainability agenda. And that's a great way of bringing like-minded people together to discuss topics that probably wouldn't normally come in a room together because of the size of the organisation, and just bounce things around. Like today I learned about using ground coffee to put on your gardens and make bricks for the fire and things was in the chat today. So yeah, I think it's just about linking in with people who are passionate about it in some way, shape or form, even if it's informal, can be really helpful.
Great, thank you, Helen. I think we've got time for one more if anybody else wants to come in. Otherwise, I want to come to Kath for any final reflections from our host before we close. Thank you, and thank you all for being so active in the chat today. We will mine that for any kind of resources and tips that we can add to our resource list to share with you all afterwards, along with the slide, and you'll also get a link to the recording. We are also going to, brilliant, Julia has put a link in to sign up to the Centre for Sustainable Healthcare newsletter. Julia is also going to add a link into the chat in a moment for our evaluation form, because we'd like to do our own quality improvement on these visits as well. So really grateful for any feedback. So before we close, Kath, can we turn to you for any final reflections?
Yeah, just a few reflections, and then I've got a few resources to share as well towards the end. But yeah, for me, it's just a really enjoyable afternoon, just seeing how many people are here and listening to all the presentations just to see how far the organisations have come, because obviously, yeah, starting out was kind of, as Helen said at the beginning, I think it was how do we tackle this? It kind of feels quite big. Sustainability always feels big, but it is using a improvement approach of just breaking it down into small steps, manageable chunks, and testing things and seeing how they work. It's always different in different contexts, isn't it? So I think it is about what can we learn from each other, but then apply it to our own context. The local case studies are always really important. I think the big thing that stood out, just thinking about these tools, it's CSH, but I've said a couple of times, but they're kind of taking the knowledge that we have and putting it into action. And we've always been thinking about what tools would be helpful, what frameworks would be helpful for people, what tools are helpful for people. But yeah, it's fair to say that I think all three of the beacon sites have gone further than the tools that we have on our, and really develop this in your own areas. And I think it's how can we share that as a community? And yeah, it's always about not reinventing the wheel, isn't it? And how do we actually share that? And I think we just had a brief chat in our breakout room about the tool, the app particularly, but also the SIA tool. It's going to be difficult to have one size fits all across the NHS we're talking about. So how do we make it possible to kind of describe how to do it in your own organisation rather than have one tool for everyone? So it's just, yeah, how can CSH support with that, or as a community, how can we do that? I just think, yeah, for me, it's just about real practical examples and tools that we can all use to do this, and whether it's doing it imperfectly, that's fine. There's definitely no one perfect way to do this, and then just getting all of these practical demonstrations out there so other people can learn from them. And obviously the key community and the network that we've got, Sustainable Healthcare Specialist Interest Group, is one way. Obviously we're always trying to do that through our networks as well at CSH, but if there are other communities and ways that we can share this, then I'd be really interested to know where people think we could share this, because it just makes sense, doesn't it, that we're sharing the tools that we all have together. And those bigger questions around how we think more upstream is the challenge, but I think it's about connecting across our ICSs and across organisations as well to think about what existing work's happening, because there's a lot of work happening around prevention, but I don't think we're sort of tied into it from a sustainability perspective. So I think it's aligning and linking up strategies as well is really important. But just more for me, it's just enjoyed all the presentations and just seeing how many people are here. I think it's exciting. I've got a couple of slides that I'm going to share, if that's okay, just for some resource for people to take away, and some of that is in the welcome pack that we shared as well, but I've put some links in the chat before people go. But I just want to highlight is that moving? Why isn't that moving? Sorry, bear with me a moment. Just the website that we have. So the Sustainability Quality Improvement website, we've got loads of resources on there. Whether that's at the doing a project level, lots of tools and templates, and I think I posted in the chat earlier around measuring environmental impact. So if you did want to see a carbon footprint study of some of the work that you're doing, but lots of tools and resources on there. And then if you are teaching others, so a lot of people here will be in that kind of capacity of sharing this knowledge. So there's some resources for teaching as well, and then access to some of the programs that we run that we've talked through today, so the Academy and the Green Teams competition, and how to actually become a beacon site yourself. So obviously everyone here gone through the Academy program, become a beacon site, but you can do that off your own back as well. So the information around all of that stuff is on there. Really want to, so I've talked about community and networks and sharing, and from a sustainability and healthcare perspective, we have our networks platform, which I think there are now over 30 networks, either discipline specific or so profession specific, or we've got networks around different specialties as well. So it's really worth, whether you're kind of in a clinical specialty role or within kind of, certain disciplines. If you're mental health trust or primary care, really, it's just, a one-stop shop for everything around sustainable healthcare, and also QI project resources. So all of the green teams competitions that we run, any projects that we're involved in, are always uploaded onto the networks, and you can search by resource. So if you search by SusQI project, there's just a wealth of resource. So really, when we're thinking about, I don't know, just some of the examples that have been used today around plastics and gloves off, so much work has already been done in those areas. So definitely go and look and see how things have been done. So we're not starting from scratch. So definitely encourage people to sign up to there. Just to talk a little bit about the academy. So obviously all of the organisations, and thank you to everyone who's presented, we've worked with through our academy programme. So we have the resources that we have on our website, but often it's kind of having that time out to really talk about and explore it further. I think the reason why we set up the academy is because we had lots of organisations come into us. Then we've got the resources, but we want a bit more input. So we wanted to streamline how we delivered that and create a community of people that are doing this. So that's what the academy offers, as well as some bespoke mentoring time, access to the resources and some additional resources. We have a network of people and organisations that are doing this. So we work with healthcare delivery organisations, but also academic organisations as well, because there's more and more students who are learning about how to do this through their undergraduate and postgraduate education. That's just a bit of information more about what that looks like. And as part of that, you become an aspiring beacon site and then established beacon site once you've kind of gone through the programme and kind of done that work around your resources and education platforms. And then our Green Teams competition at CSH, so a few of the examples, so Faye and Caroline particularly talked through a couple of their case studies, which were through the Green Teams competition process. So that's where we go into organisations, or virtually go into organisations and run. It's normally six projects over 10 to 12 week periods. So we get the kind of initial stages of a quality improvement project started, and it's really a really great engagement programme for people across the levels of the organisation. So we've talked quite a lot about senior leadership engagement, and the Green Teams competition definitely kind of highlights the need for clinical engagement and engagement across services. So CSH provide a lot of support in terms of actually getting the improvement projects set up and going, and the measurement elements, but engages sustainability leads, QI leads, and kind of gets people talking about that same language. We also talked about how do you kind of bring these people together, and the Green Teams competition is definitely one way to do that. More courses, we'll, in addition to those, we'll offer a lot of courses at CSH. These are just some of them on the screen there. So we have our SusQI course teaching SusQI and also carbon footprinting. So that carbon literacy, it's kind of beyond that. It's kind of really, how do you do this? How do you do the carbon footprint study from a technical perspective? And then obviously the Q community. So yeah, massive thank you to Vicky and Julia for hosting today and giving us the opportunity to talk about what we talked about. We have the Sustainable Healthcare SIG on the Q community, which I think is definitely one of the places that we can share some of the tools and resources that we've talked about as a quality improvement community, as well as the CSH networks and other networks that we're involved in. So yeah, definitely, if you're not already a member of that, definitely encourage you to sign up. And yeah, just to mention, there's lots and lots of other groups that are working on climate and health and sustainable healthcare, just to name a few. But I've also left at the end some links to resources for support, because obviously, yeah, I know a lot of you are already doing this work and know a lot of this already, but if it's new to you, then there's some ideas of people to contact beyond CSH and this community if you want to. So yeah, that's it. I will leave it there, and just a massive thank you again for Vicky and Julia and everyone this afternoon. It's been really great, so thank you so much.
Thank you, Kath, and yeah, thank you to Kath, Helen, Jo, Kate, Nick, Faye, Caroline. You were all great, and we really appreciate you being so generous and sharing your your journeys and your tips and your tools and everything. So thank you, and thank you all for coming and listening and contributing in the chat. I hope you have a lovely rest of your afternoon.